Hello and namaste to all of you. This is Singh from Department of Physiotherapy and Diagnostics from Jayoti Vidyapeeth Women's University. So today I'll be telling you all about calcium in urine test. What is basically calcium in urine test? So calcium in urine uh, it test measures the amount of calcium in your urine. So calcium is one of the most important minerals in your body, and you need calcium for healthy bones and teeth. And calcium is also essential for proper functioning of your nerves, muscles, and heart. And almost all of your body's calcium is stored in your bones. So a small amount will circulate in blood, and the remainder is filtered by the kidneys and passed into urine. Now, if urine calcium levels are too high or too low, it may mean that you have a medical condition such as kidney disease or kidney stone. And kidney stones are basically hard, pebble like substances that can form in one or both the kidneys when calcium or other minerals build up in urine. So, most kidney stones are formed from calcium. Now, too much or too little calcium in blood is also indication of a kidney disorder, and as well as a certain bone diseases and other medical problems. So if you have symptoms of one of these disorders, so you have to visit the doctors and who will prescribe you for a calcium blood test along with the calcium in your urine test. And in addition, calcium blood test is often included as a part of your regular checkup. Now, what is this test basically used for? So, calcium in urine test may be used to diagnose or monitor kidney function or kidney stones, and it may also be used to diagnose disorders of parathyroid gland, which is associated near the thyroid, and that helps regulate the amount of calcium in your body. So why would one need calcium in a urine test? So one may need calcium in urine test if they have symptoms of a kidney stone, and these symptoms may include severe back pain, abdominal pain, nausea and vomiting, blood in urine, and frequent urination. So one may need calcium in urine test if they have symptoms of parathyroid disorders, and symptoms of too much parathyroid hormone may include nausea, vomiting, loss of appetite, abdominal pain, fatigue, frequent urination, both bone and joint pain. So, and now the symptoms of too little parathyroid thyroid hormone includes your abdominal pain, your muscle cramps, tingling sensations in your fingers, your dry skin, and brittle nails. So, what basically happens during calcium in urine test? So, one needs to collect all the urine during a 24-hour period. So, this will be called as your 24-hour urine sample test, and the doctor will or the laboratory technician will provide you with a container to collect your urine, and instructions will be given on how to store the urine sample. Also, a 24-hour urine sample test generally include steps such as empty your bladder in morning and flush that urine down. Secondly, do not collect this urine and record the time. So for next 24 hours, you have to save your urine in a container provided and store your urine container in a refrigerator or a cooler with ice. Nextly, you have to return the sample container to the healthcare provider's office and laboratory as instructed. So, so if do you need anything to prepare the test? So you may be asked to avoid certain foods and medicines for several days before the test. So if and rest other instructions will be given, and there are no risks posing in calcium urine test. And if you what will the results basically mean? So if your results show higher than normal calcium levels in your urine, it may indicate risk or presence of a kidney stone, and hyperparathyroidism, which is a condition in which parathyroid gland produces too much of parathyroid hormone. And secondly, next can be your sarcoidosis, which is a disease that causes inflammation in lungs, lymph nodes, and other organs. And too much of calcium in your diet from vitamin D supplements or milk. So, if your results show lower than normal calcium levels in urine, it may indicate hypoparathyroidism, which is a condition in which your parathyroid gland produces too little parathyroid hormone, and vitamin D deficiency, and a kidney disorder. So, if your calcium levels are not normal, it doesn't necessarily mean that you have a medical condition that needs treatment, or other factors such as diet, supplements, and other medicines that includes anti-acids and can affect your urine calcium levels. So, address any further grievances, you can always contact your healthcare provider. So, a calcium in urine test does not tell you how much calcium is in your bones. So, bone health can be measured by the type of X-ray and a test which is called as bone density scan or DEXA scan. So, DEXA scan measures the mineral content, including your calcium and other aspects of your bone. So that was all about the calcium in urine test. So if you have any doubts regarding this calcium in urine test, you can contact me. And until then, take care and bye bye.